Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahy. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of leaders. On this podcast, we will share stories from physicians in various medical specialties and those in roles that support the advancement of medicine to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome, everyone. I am so excited to have Dr. Liz Matzkin as the first guest on the Lead Change podcast. Dr. Matzkin is the Director of Sports Medicine Fellowship Program at Mass General, Brigham, and Associate Professor of Orthopedic Surgery at Harvard Medical School. She has developed a world-class program for female athletes with a robust research program focusing on women's sports medicine. Dr. Matzkin is highly regarded for her accomplishments in education, research, and patient care. She completed her surgical and orthopedic residency training at the University of Hawaii, and then from there she completed a fellowship in shoulder and sports medicine surgery at Duke University School of Medicine. During that time, she served as an assistant team physician to the Duke University football and men's basketball teams. And prior to developing an outstanding women's sports medicine program at the Brigham, Dr. Matzkin was an assistant professor at Tufts University School of Medicine. She has cared for the U.S. soccer teams and U.S. women's hockey teams. She is currently head team physician for Stonehill College. Dr. Matzkin has 3 athletic daughters, which really drives her passion to improve the care of all female athletes. And in her free time, she loves running, snowboarding, and spending time with her husband and her 3 daughters. Liz and I have been friends and sports medicine colleagues for years. I respect her tremendously, and I'm so excited to have her share her insight from her leadership journey. Dr. Matzkin is very well respected in sports medicine, and she has contributed substantially to our field. So, Liz, thank you so much for being here.
Mary, thank you for having me. And before we really get started, I just want to say congratulations on this podcast. I remember when you said someday I want to start a podcast, and you set a goal. And here you are. And, I feel like I've been lucky to follow your career and your successes, both as a colleague and a friend. And I'm super excited to be here with you now.
Great. Thank you so much. I really appreciate that. So before we really dive into a lot of the specific leadership stuff, I'm hoping you can share with all of us a little bit about where you are now and what you do and what you really love about your practice.
So I, as you mentioned, I practice sports medicine at Mass General Brigham, which is part of the Harvard program in Boston, Massachusetts. I have a busy clinical practice. I work with medical students, residents. I am the fellowship director. So a lot of education, a lot of just leadership on a day-to-day basis with my team. I take care of multiple different sports teams. And then, in my free time, I try to stay active and spend as much time with my family as possible.
Yeah, that's awesome. And you really do a great job. I see that just in our interactions at meetings. I see that on things you share via social media. And I love to see your girls and how successful they are with their sports and how much fun they're having and all the things that you guys get to do together, which really means a lot. I'm curious, with all of the things that you're involved in and the many successes you've had in your career, what really drives you, right? What's the main motivating force for you in all that you do?
I think where I am now in my career, I think honestly, motivation is twofold. One, to take excellent care of my patients. I love my patients, and my goal is to make them better in any way I can. And then 2 is really to mentor the next generation. It's not the awards or the leadership positions that bring me joy. It's the cards and the thank yous from past students or past residents or research assistants, and then to see them succeed, to follow their successes, whether it's getting into medical school, matching an orthopedic residency, doing a fellowship, seeing them up on the podium, presenting research. Those are the things that probably bring me the most happiness in my practice.
Yeah, I love that too. And I love it's such a great experience to be able to watch those that you've mentored, right? And be successful. And, Gio, who's with you now in practice, being a fellow and now working with you at the Brigham and seeing all her success and the success of many of your research assistants and now being in medical school, et cetera. So I can see you take a lot of pride in that. And so in addition to those type of things, is there a particular instance or like a person or some type of event that really inspired you to want to pursue leadership positions and really be involved at that level?
There's one specific event, but I would definitely say that I was very inspired by my dad. My dad was a natural leader. He was always a great listener, a thoughtful responder. He was always fair but stood his ground when I was, growing up. He was an oral and maxillofacial surgeon, and I got to grow up watching him lead both locally and nationally. So I'm sure that left a impression on me in a very significant way. But I also feel that every mentor I've probably had have inspired me to lead in different ways.
That's fantastic about your dad. I didn't know that story, so that's wonderful, and how he sort of initiated all of that. But I agree, and we'll sort of touch on this a little bit more, but I think it's really incredible how the different people we interact with, mentors, leaders on committees, leaders within and outside of our institutions, how they can really touch and shape us and how we kind of extract different things from these people that we work with. How would you describe your leadership style, Liz? And in what ways do you find that style that whether you lead your team or you lead a committee or you lead a big group within the American Academy of Orthopaedic Surgeons, how do you find that leadership style to be effective?
So I would like to think that I'm a team builder. And I think I thrive in an environment where there is collaboration and where inquiry is encouraged and there can be constructive debate, a place where, assumptions can be challenged. And I think it works best when I'm able to participate and everyone around me is participating. I know that I'm better when I surround myself with good people. And for me, success is a team sport. And I think it is that way for a lot of people. But I know that there's nothing I can do and be really, truly successful on my own.
Yeah, that's fantastic advice. And I think it's interesting. I think as sports medicine surgeons, we do these things so much. You're taking care of teams, you're working in teams. Many people were athletes. And so I think all of those experiences, and maybe I think you've touched on this in just the comments so far, I think all of that really contributes to shaping that style and that approach, and it really makes you a very effective leader. And I've had the huge pleasure of working with you in many roles, and so I agree. I think you do an excellent job at doing that, and including everyone and wanting to hear everybody's opinion, allowing everybody to contribute, and really working to everyone's strengths and allowing them to contribute in that way. You have so many leadership roles every day and in multiple capacities within and outside of the Brigham, but I did want to touch on a few in particular. So you really did an amazing job being the inaugural membership council chair for the American Academy of Orthopaedic Surgeons. Can you share with us a little bit about how that role came to be, how you came to serve in that role? What were some of your main responsibilities, and really what did you learn by serving in that position?
So I was lucky to be on the AOS Board of Directors as a membership at large when they were somewhat restructuring some of the committees and the governance within the AAOS. And, this was 5 years ago now, almost 6. And we didn't have a true understanding of who our members were. And so they were going to, start this membership council that would include membership, communications, international committee, the resident assembly, and the diversity advisory board, and pull it all together. So it's kind of a diverse group of committees that were going to be pulled together under the membership council. And so I had a lot of insight into the background of what was going on and how they were doing all this. I just happened to be very lucky to be sitting in the boardroom at the time. And And, I interviewed and was appointed to the membership council, and it was a fantastic opportunity to really build something new. But, it was a complete collaborative effort. It took a lot of work from many different committee volunteers from multiple different committees that pulled together. And it sometimes had differing views about how things should go, but we were able to find common ground. And, now the membership council is soaring under new leadership, and it was a good time. It was a lot of work, but it was a good time.
What were some of the main things that you learned? And I guess even before diving into that, the term, it was 3 years in that position?
So 2 plus 2.
2 plus 2. Okay, so you served for 4 years in that position. And what were some of the key things that you took away that maybe you can share with anyone who's listening?
I think I learned about just being open-minded, really listening to the different opinions and how we should go about things. Certainly being clear and having clear communication, clear expectations, clear about what I knew or what I didn't know or didn't understand. Having good self-awareness and situational awareness to pull this all together, I think were important aspects just as trying to lead this kind of mishmash team to become cohesive.
Yeah, it's a pretty unique and I imagine really interesting experience, like quite different from other leadership roles where you're working with so many different groups. Like you mentioned, it was really a collaborative effort, but a unique opportunity and unique demands and huge responsibilities to be kind of the first person to serve in that role. So congratulations on sort of setting the framework and helping to like really launch that.
No, and sitting in the boardroom over the 6 years that I was in there, I learned during the time, even as membership council chair, so much from watching the different presidents lead. So I was able to sit in the boardroom through 6 different president leaders and take, nuggets of good and bad from all of them.
That's amazing. That is really incredible. And actually, we're definitely going to expand on that. And actually, since it leads in perfectly, I would love for you to share a little bit, obviously not specifics about one particular president or leader, but what are some lessons that you've learned from leaders that you admire or you respect? And what is it about some of those people that really makes them good and effective leaders?
I think there's so many different types of good or effective leaders, but certainly from my standpoint, someone who can inspire me, like make me excited about whatever work lies ahead or whatever our goals may be. So that, and then building trust, being able to listen to diverse opinions, being able to be vulnerable. We hear so much more about that nowadays, I think, than we used to. And then I think there also is a point in time where as much as you want to listen and hear from everyone, you still need to be decisive, right? Because we still need to move forward, right? There has to be forward momentum. And it's a fine line and a hard balance, I think, to achieve for a truly effective leader.
Yeah, those are excellent points and really kind of unique traits to pull out. Like, I love how you summarize that all together, but like things that you admire, things that you recognize, things that you respect, but then ultimately, right, the person in that role has to be able to lead the group and help kind of keep things moving forward. On the other end, a little bit, what are some experiences you've had with leaders that maybe you didn't connect with as much or you don't necessarily agree with their leadership style? And what are some of the lessons you took away from that have helped shape or influence your own leadership style?
Well, I think, we're lucky to be in a field where it's continuous learning. Like, I learn something new every day. And so I think same for leadership. And some of the leaders that perhaps maybe I didn't find did the greatest job were probably those that didn't listen. Perhaps they made me lose trust or that desire to be led by them. I think one of the biggest things is working with leaders that are afraid of change. And I don't think change is ever easy. I think change is always very difficult, but it's also extremely necessary. So leaders that are afraid of change, I think just personally will frustrate me. I also have seen leaders that just want to appease everyone, make everyone happy. And as much as I wish I could always make everyone happy, even in my family at dinner time, I wish I could make everyone happy. But, it's nearly impossible. And sometimes you just have to accept the losses. And, it's okay to tell someone that, I understand your feelings and I'm sorry it didn't quite go exactly the way you wanted, but this was the group decision. This is how we got there. But, it's near impossible to try and make everyone happy, or you're just not going to move the pendulum in whatever direction you're trying. And then I think if you're not willing to take a chance or be vulnerable, you're going to have very little impact. And I think I've been able to see some of those things and learn along the way. And I'm sure I've made all the mistakes at some point in my career as well. It's a learning process.
You learn, exactly. I was said that's part of the learning process. But I think you've made such great points about how you can learn from, maybe people you consider to be great leaders, but also how you learn and take a lot of lessons, really valuable lessons, from leaders who maybe you don't quite connect with or don't respect as much. Or so I think, interacting with both types of people are hugely valuable in our own learning experiences, our own leadership journey, and really shaping how we want to lead in the different teams and groups that we're involved in. So thank you so much for sharing those points. Getting back a little bit to a couple of the other leadership roles that you have. So we mentioned initially that you serve as head team physician at Stonehill College and that you're the director for the sports fellowship at Brigham and Women's. So congratulations again, those roles are just fantastic. And how do you use your leadership skills in those specific roles?
Yeah, they're very different roles. This is where, as orthopedic surgeons or sports medicine surgeons, we play a leadership role almost unknowingly and unconsciously all day long. Whether it's in the operating room, leading your team, in the training room, like when I'm at Stonehill College, and I'm a petite female taking care of 100 football players in the training room, and you have to command the room to a certain degree. And, you have to earn the respect of the athletic trainers and the athletes over time. And I think you do that by being competent, being fair, listening to them, providing the best care, calling a friend, referring to a colleague when, you don't, and I've been lucky to be with the team now for many, many years. And though taking care of a Division I college team is not something I can do alone. I mean, I have partners who are my go-to for foot and ankle and for hand injuries or ENT or, some weird rash that a player may have. So you have to always build your team. And so I would never be a great, head team physician without all these other people around me, including my fellows who take a large role in helping care for these athletes. And, as the fellowship director, I think it's a huge responsibility because not only are we teaching our fellows how to be great surgeons and great clinicians, but just how to be good citizens in this kind of ever-changing, crazy world of medicine, and how to balance finances and family and all the other things that we don't think about on a regular basis. But I try to, share with them and be authentic.
Yeah, those are great points, separately about team physician and the being fellowship director roles. I think, just building on that fellowship director, obviously the huge part of that fellowship here, right, is to learn the surgical skills specific to sports medicine, be comfortable and confident in doing that. But you raised an excellent point that is also the time where you're helping with some of the practice management stuff, some of the professional development, being a good citizen, right? That's an excellent description, just being a good person and contributing to the field and being engaged. And that is a lot, I think you're absolutely right, of what comes out of that year. And so it's great that you take a lot of pride in sharing those skills with your fellows as well. Because then they go out and they're going out to practice independently. You want them to be successful, not only in their clinical practice, but in their life and of the other aspects of their career. So it's really important for them to get those foundational skills during that time too. And you raised some really important points too about being a team physician and, wanting to build trust and show competence and confidence in interacting with the team and taking care of the players. And what have you found are some important and helpful ways to do that to build that trust, to earn the respect?
Well, I think especially like in the training room when I'm seeing athletes, like I'm fully focused on that athlete, and the athletic trainer is completely involved in the care of that patient with me. The athletic trainers are working with these kids day in, day out. They know what kids come in when they have a hangnail and what kids don't come in till their leg is falling off. And they know the nuances and the social situations and the psychological situations and all these other things that can play a big role in injury and sports and everything. So I think it takes a full team to take care of the team. And then it doesn't happen overnight. It takes time. I mean, I'm sure when I started as the head team physician, I'm sure people were like, who's she? What is she, what's she got going on, But you just, over time, you take good care, make the diagnosis, you take care of the patients, you do the good surgeries, you rehab them properly, you have, heart-to-heart talks when they're going to miss a season with their parents, with the coach, with the athlete. I often am giving the athletes my cell phone number so their mom can call me later that night just because they're going to have questions. And, sometimes it's just easier to, handle them than to push them off and just address them head on and just, because it's hard. It can be as hard for, the family and parents of these kids when you say they're going to, miss their baseball season or their lacrosse season, or there's just no other way around it.
Yeah, those are all like really, really important points and help tremendously to develop that relationship. And some other things that I found, I think it's a big part of it is being present, like being around, being engaged and involved, and not just at the time when the athlete is injured, right? And you sort of alluded to that. It's like you want to have the relationship in place before they're ever injured, because that's a time when they're scared and they're worried and they're confused about what's going on. And so to already have a very good relationship with you makes them that much more comfortable. And so I think, if you have the opportunity to be present at practice or to certainly be there at games, be engaged with the team, travel if and when possible, but just having the interactions with the players and the coaches, I think helps tremendously with all these different situations that the athletes will face. And I think it's a fun part of what we do, and I think we're really lucky. So I've had a similar experience, especially taking care of women's basketball here at Loyola. Switching gears a little bit, so have you participated in any specific leadership training courses that you have found to be particularly helpful, whether that's within or outside of the Brigham, specific to sports medicine or not?
Many years ago, the AOS had the leadership kind of fellows that went through like a year-long leadership kind of course. And that was probably the first that really pushed me into learning more about this. And then over the last many years, I've participated in many different leadership courses. I'm lucky to be at an institution at Harvard where, they're somewhat abundant, whether they're just seminars, a few hours, or their whole day or several days. I just completed recently a course called Great on the Job that really teaches you how to be a better leader, basically in your professional job. Another one I did was I worked with a one-on-one coach through the BOTA group, which is a group that works with people on leadership skills training. I've worked with a life medicine specialist, and really most of it is just for curiosity and to learn almost more about myself, right? And to understand more about who I am and how I can change to be better.
And it's kind of in line with what we've talked about previously too, is that just looking to just continue growing and building and developing. And so all of those leadership type courses that you've done are really phenomenal. I think have built on each other. I think every time you participate in something as you're further along in your career, you extract new things from that too. And also in line with sort of learning or being exposed to different leadership type skills, are there any books that you've read, leadership type books that you've found to be impactful or have maybe influenced or helped shape you as a leader?
I feel like I've read many. Some have stuck more than others. Certainly Brené Brown, Dare to Lead, resonated with me for sure. I would probably put that out there as one of the best ones. And then I think some of the other books that I think, especially as a female, that have been important, probably been The Confidence Gap, really understanding, confidence and versus competence and where we go with that. I think some time management type books, or Eat That Frog. I think that was...
I have not read that one, but...
No, I think that was Brian Tracy. It's a very quick read.
Nice.
But I think as busy people, and especially leaders, there's always a long to-do list and a lot on your plate. And that really just goes through how to manage all these tasks you have to do, and, how to, take care of the one that's really most important, rather maybe than just, or do you check off the little ones? But it was just a thoughtful book. It made me think about how I am going to get through each day or each week or each month of tasks. But there's so many great books out there. And I recently read, I think just like the whole world is reading, Let Them Theory by Mel Robbins. And have you read that yet?
I have not, no.
No, and it's really not a leadership book per se. But interestingly, I feel like it's been very helpful. And even if you think about if there's a leader or someone in your group that you don't agree with their style or what they're saying, rather than like perseverate on it, you just be like, let them lead the way they want to lead, and then you move on. And even though it's not a leadership book, I feel like it's been very helpful, because it's one, I just am like, okay, let them be. That's who they are. I'm not going to change them.
You do you.
And then I don't waste time perseverating on it. So, yeah. I mean, there's so many great books out there, but that would be just a few of the ones that I have found to be, or have most resonated with me.
That's great. Well, good. Now I have a couple of other books to read. So thank you so much for that. You touched, you spoke about The Confidence Gap, and even, Dare to Lead by Brene Brown, which really speak a lot to women in leadership positions, especially. So what skills do you think are really necessary to be successful leader as a female physician? Are there any specific skills that you would especially emphasize for women in medicine?
Yeah, I mean, obviously I'm biased, but I do think it is harder for females in general. And, certainly in medicine, and even more so probably in orthopedic surgery, where we're still, a significant minority. So I would say, one, build your brand or in your culture, know who you are. I think you need to be authentic, or people aren't going to believe you or trust you. And then I think you have to be competent, and that's probably the biggest advice I give to, certainly younger females out there, is that worry about your competence first, right? Make sure you're a great surgeon. It's what we train to be, a great, clinician. And those skills will then translate. So, you have to be competent. You have to be authentic. You should probably have a vision, a goal, some type of innovative, forward thinking, something that's going to drive you to be an inspiring leader, right? Because if there's nothing that's, exciting about it, it's going to be harder. We always talk about the likability, are you a bitch or are you a boss? Compared to men, right? We're nagging while the guys are more persistent. Men are passionate and we just are hysterical or dramatic. So, there's always this fine line of bias that, we have to be careful with, right? Women are pushy, men are ambitious, and, walking those fine lines. But I think if you just start from the basics, then you will move forward.
That is such excellent advice. And I love too, we're surgeons. We both happen to be surgeons. So that competence is absolutely critical, but it's really competence in any field, whatever it is, your trade, your craft, that you are excellent at that. And then building these like very important, fantastic leadership skills that you touched on. And I love how you summarized that. And those are really some key things that actually I haven't heard those put together in that way. And I think it's really valuable to share that with everyone. I wonder, Liz, what would you describe as your superpower? Meaning, what's one of your biggest strengths that contributes to your success and really helps set you apart?
I don't usually think of me as having a superpower, although I do have 3 daughters that challenge me daily. I would say that I think I am resilient I am willing to listen to constructive criticism and really take it to heart, but not overthink it, not let it, take me down or depress me, but figure out how I can turn it around to make a situation or myself better. I would say just an ability to try and stay level-headed.
Yeah, I think that is your superpower, Liz. Yeah, that's awesome. And what do you do for yourself? We touched on this very briefly in the intro, but what do you do for yourself? How do you support your wellness? How do you protect your peace? How do you protect the things that are important to you?
Yeah, so and I think honestly, as I've maybe gotten more mature in my career, I feel like I've learned more how to establish boundaries. And I think we've talked about this, when we can say no, and learning maybe to not put myself out in too many places at one time. And I think one of my boundaries is that I am very committed to exercise, to wellness, to spending time with my family. And I know you are as well. I mean, when we're at meetings, we're in the gym first thing in the morning, and whether it's for 20 minutes or an hour, but getting that done. And so it's a commitment I make. I try to eat well. I try to get to bed at a reasonable hour. But I think you have to establish those boundaries and have really excellent time management skills. I'm a better person if I can also take care of myself. And for me, taking care of myself is whether I outside for a walk, for a run, for a hike, for a bike. It could be almost anything, a quick lift at the gym, an exercise class, just something that just makes me feel better as a person.
Yeah, I love that. And it's so important, and it's great that you prioritize that, because it really sets the tone for everything else that you're doing, right? And taking care of yourself is so important to be able to help take care of other people, or patients, or families, the teams, all of those different groups that you're involved with. And so nearing the end now, but before asking you a few sort of final questions, I wanted to ask you, this podcast, this Lead Change podcast, and I'm curious, what does lead change mean to you? When you hear that, what does that mean to you?
To me, it means that someone like Mary Mulcahy had a vision and took that vision to make change and influence others in a positive way.
Thank you for sharing that. Do you have a favorite quote?
Be so good they cannot ignore you.
I love that. Thank you. So, Liz, before we round this out, is there anything else that you would want to share with people who are listening, who are very, very interested in leadership, and specifically for women in medicine to be successful?
Yeah, I think leadership is a lifelong journey. That's what I would share. I don't think there's and you have to have a particular style. I don't think there's a right way or a wrong way. Leadership is rarely obvious, and it's usually a team sport.
That is awesome. Thank you so much for that excellent summary and for everything that you shared. I really, really appreciate you being here. You are such a great friend and colleague, and I really do respect you tremendously. And it's a huge honor to have you as the first guest on this podcast. So thank you again for being here.
Thank you, Mary. Good luck with this podcast. I'm sure it's going to be popular.
Thank you so much.